Inflammation, everyday strategies for calming the body. Chronic, low-grade inflammation is linked to many modern diseases, but everyday choices can either worsen or alleviate it. This article brings together practical, research-based strategies that can realistically be incorporated into daily life, from diet and movement to stress, sleep, and even infrared sauna use. Move your body regularly. Physical activity is one of the most effective ways to combat chronic inflammation. Regular movement helps regulate blood sugar levels, maintain a healthy body weight, improve circulation, and modulate immune function, gradually reducing inflammatory burden. You don't need intense workouts to see benefits. Aim for most days of the week to include brisk walking or light jogging, cycling, swimming, or dancing, light strength training using body weight, resistance bands, or dumbbells 2 to 3 times per week. Consistency matters more than perfection. Spreading movement throughout the day, taking the stairs, walking during phone calls, or doing short movement breaks can contribute to a more balanced inflammatory state over the long term. Follow an anti-inflammatory diet. Food is a constant signal to the immune system. An anti-inflammatory diet is based on whole, minimally processed foods rich in fiber, antioxidants, and healthy fats, while limiting substances that promote oxidative stress and inflammation. Helpful options include plenty of vegetables and fruits in a variety of colors, fresh or frozen. Whole grains such as oats, brown rice, quinoa, and whole grain bread. Healthy fats from extra virgin olive oil, nuts, seeds, and avocados. Fatty fish, e.g., salmon, mackerel, sardines, rich in omega-3 fatty acids. Legumes such as lentils, chickpeas, and beans. Try to limit sugary drinks, sweets, and pastries. Highly processed foods and fast food. Trans fats and excessive intake of deep-fried foods. Large amounts of processed and red meat. Think about building your plate. Half vegetables, 1/4 lean protein, fish, legumes, poultry, and 1/4 whole grains with added healthy fats. Small, sustainable changes, such as replacing sugary snacks with nuts and fruit or swapping red meat for fish a few times a week, can gradually shift your body toward a less inflammatory profile. Take care of good sleep. Sleep is a daily reset for the nervous and immune systems. Too little or irregular sleep increases inflammatory markers in the body and makes recovery from stress, infections, or physical exertion more difficult. Basic sleep habits include: for most adults, a general guideline is about 7-9 hours of sleep per night. Going to bed and waking up at roughly the same time every day, including weekends. Creating a calming routine, dim lighting, quiet activities, stretching, reading. Limiting screen time and dedicating at least 30-60 minutes before bed to calming activities. Reducing caffeine and large meals late in the evening. If you wake up feeling unrefreshed most days, have trouble falling or staying asleep, or snore loudly, it's worth discussing this with a doctor. Improving sleep quality often has noticeable effects on inflammation, mood, and energy levels. Managing stress to cool the inner fire. Chronic psychological stress keeps the body in a state of heightened alert, constantly releasing stress hormones and inflammatory mediators. Over time, this can contribute to the development or worsening of inflammation in the joints, gut, blood vessels, and other tissues. You can't eliminate stress entirely, but you can change how your body experiences it. Helpful approaches include regular relaxation practices, slow breathing, meditation, prayer, or mindfulness. Gentle movements such as yoga, tai chi, or stretching. Time spent in nature, walks in parks, forest paths, or near water. Meaningful social connections with friends, family, or community groups. Even a few minutes a day of intentional relaxation can make a difference. The key is to treat stress management like nervous system hygiene, a regular, intentional practice rather than an emergency measure used only when you feel overwhelmed. Avoid smoking and limit alcohol. Tobacco smoke introduces a wide range of pro-oxidative and pro-inflammatory substances into the body, damaging blood vessels and tissues and increasing systemic inflammation. Quitting smoking, or not starting at all, is one of the most effective actions for reducing inflammation and disease risk. Alcohol, especially in large amounts, also promotes inflammation and can damage the liver, gut, and other organs. For people who drink, moderate and occasional consumption is generally safer than daily or heavy intake. Some individuals, due to health conditions, medications, or personal or family history, should avoid alcohol entirely. If you smoke or drink regularly and want to cut back, structured support, therapy, medical advice, support groups can significantly improve your chances of success. Protect your airways and sinuses. The airways are constantly exposed to air, particles, and microorganisms. Chronic irritation of the respiratory tract and sinuses can intensify local and sometimes systemic inflammation. To protect this delicate system, ventilate your home regularly to reduce indoor pollutants. Avoid exposure to secondhand smoke whenever possible. Address dust, mold, and strong chemical fumes in the home. In dry environments, consider gentle humidification to protect mucous membranes. If you frequently experience nasal congestion, sinus pain, or recurrent sinus infections, addressing environmental factors and working with a doctor to treat allergies or structural issues, such as a deviated septum, may reduce recurring inflammation. Maintain good oral health. The mouth is a gateway to the body, and chronic gum inflammation is associated with increased systemic inflammation. Periodontal disease has been linked to cardiovascular problems and other systemic conditions. Basic oral hygiene habits matter. Brush your teeth at least twice daily with fluoride toothpaste. Clean between teeth daily using floss or interdental brushes. Visit the dentist regularly for professional cleaning and checkups. Address bleeding gums, persistent bad breath, or tooth pain promptly rather than waiting. By reducing bacterial load and inflammation in the mouth, you eliminate another chronic source of immune activation in the body. Respond early to infections. Pushing through significant infections without adequate rest and care can turn acute inflammation into a chronic problem. The immune system needs support and time to effectively clear infections. Helpful practices include resting and reducing physical and mental exertion during clear illness, staying well hydrated and eating light, nourishing meals, consulting a doctor if symptoms are severe, unusual, or persist longer than expected, completing prescribed treatments properly rather than stopping early once you feel better, listening to your body and seeking help when something feels off or prolonged can prevent acute episodes from turning into long-lasting inflammatory conditions. Consider targeted supplementation when needed. Diet should remain the foundation, but in some cases supplements may play a supportive role in managing inflammation. Common examples include vitamin D, especially in regions with limited sunlight, omega-3 fatty acids from fish or algae oil, and certain antioxidant or polyphenol-rich preparations. However, supplements should complement, not replace, a healthy lifestyle and recommended therapies. It's wise to discuss them with a healthcare professional, especially if you take medications or have chronic conditions. Testing for deficiencies, e.g., vitamin D, can help tailor supplementation rather than relying on guesswork. Thoughtful, individualized supplementation may support the body's anti-inflammatory capacity, but more does not always mean better, and self-prescribing high doses carries risks. Infrared sauna as a supportive tool. Infrared saunas use infrared light to heat the body more directly and typically operate at lower air temperatures than traditional saunas. Many people find them more comfortable, and they are increasingly recommended for relaxation and potential anti-inflammatory effects. Potential benefits include improved circulation. Heat dilates blood vessels, potentially enhancing delivery of nutrients and oxygen to tissues and aiding removal of metabolic byproducts. Possible short-term reductions in inflammatory mediators, which may help reduce pain and stiffness in some individuals. Muscle relaxation and tension relief, which may indirectly reduce stress and improve sleep quality. As an adjunct in managing chronic joint or muscle pain and certain rheumatic conditions, with medical approval. However, safety guidelines are important. Stay well hydrated before and after each session. Start with shorter sessions and moderate temperatures, especially if you are new to sauna use. If you experience dizziness, nausea, shortness of breath, or feel unwell, leave the sauna immediately. Be aware of contraindications. Certain heart conditions, uncontrolled high blood pressure, pregnancy, severe chronic illness, or acute infections may make sauna use unsafe. Infrared sauna should be viewed as a complement, a supportive practice that may enhance relaxation and subjective well-being, not as a primary treatment. It does not replace medical care, medication, or rehabilitation when those are needed. Bringing it all together in daily life. Preventing chronic inflammation is not about finding one perfect therapy, but about aligning many small habits in the same beneficial direction. An inflammation-friendly day might include a nourishing, largely plant-based breakfast and lunch, incorporating walking or other moderate activity into your daily routine, brief, intentional stress relief practices, a calming evening routine that protects your sleep, good oral hygiene and attention to your living environment, occasional infrared sauna sessions, if they suit your health and you enjoy them. Over time, these choices send your immune system a consistent signal of safety and balance. The goal is not to eliminate inflammation, which is also an essential defense mechanism, but to keep it proportionate, well-regulated, and aligned with long-term health.